The healthcare system in Belgium is considered one of the best ever created to support the old and aging population. This agenda to prepare and adopt a healthcare policy was nurtured at the time the World War in Europe was at its peak in 1944.
And so at that time there were politicians working here together with civil servants to formalize social protection and to rationalize it, because it was a means to avoid upheaval after the war and to provide stability. People were at that time afraid for all kinds of communist revolutions or other, and so in that sense the introduction of a solid system of social protection was a means to provide that kind of stability and social cohesion.
Depression is one of the highest ranking issues that the healthcare insurance in Belgium is treating, but that's not the only problem. The issue is that there's a younger working force which is smaller in number, contributing to the health insurance and helping a larger majority of the old aging population. The government is now cutting costs.
And so we try to reduce some privileges by savings, introducing savings and cost cuts, but we try to do it in a right and a balanced way.
The Social Security Fund now stands at 77 billion euros, which is 30% of Belgium's GDP. The citizens make a compulsory contribution to the healthcare system as high as 40%, with other schemes such as unemployment benefits and pension following.
Social protection is not a luxury. Sometimes people see it as a luxury, but that's not the case. It's part of your political and economic fabric. And I think in Africa as well as Europe, it will work in the same way. It will provide the necessary stability, especially among your younger generation.
So first of all, the healthcare has become a lot more sophisticated, than it was maybe 30, 40 years ago. It is therefore much, much more costly to provide these kind of machines. And don't forget that even though we have put more money into healthcare, our population growth. You see, when I came in 1986, we had 16 million people. Now we are over 40 million.
For a healthy economy to thrive, any country certainly needs a healthy workforce. And while Uganda continues to struggle with its ailing healthcare system countrywide, the cost of medical care still remains a pill for the privileged. The broken healthcare systems, if not addressed, could be the next leading cause of brain drain and persistent political instability in the Great Lakes region. Arinaitwe, NTV, Brussels, Belgium.